Good morning. My name is Lily. I'm just finishing up getting your chart ready to fill it out. We have all the information that you did on the survey, but today we are doing some measuring and we are going to be hooking you up to the brain scan. What this appointment is about completely is finding exactly where we're going in to remove those intrusive thoughts. Everybody's intrusive thoughts are different, and they're all different, in different parts of their brain. So today we're measuring you to make sure that we cut out the right spots. So the first thing I have to do today is clean your ears, which the surgery completely takes place in through your ears. So I need to put some sensors in there. I need to do a little measuring there. And the sensors don't stick properly if there's any wax in there. So I'm just going to clean them out really quick. And then after that, we will get to measuring your head, which is how we decide what instruments and stuff we're going to use. So let's go ahead and start with the cleaning part. I'm just going to grab my otoscope. Okay. And I'm just going to take a look inside of your ears really quickly here. Okay. Okay. Yeah, I'll just go in with a pick. And we'll take care of that really quickly. I'd like to do the measuring before we hook you up with the electrodes. Just because that's the order I usually go in. I am a creature of habit. Okay, yeah, we'll need to clean out both of them, but it won't take us long. Okay, I'm just gonna very gently go into your ears and just like that, we're gonna get that wax out. Let me grab a paper towel really quickly here. Gotta have somewhere to put the wax. Okay. Oh, we've been doing this for several years now. It has a really excellent success rate. There are ways in which it doesn't succeed. There's no danger to you, but sometimes we fail at removing the intrusive thoughts. But we recently have renovated the procedure a little bit. Well, so we remove the intrusive thoughts, but at the same time we also insert a very small device in your brain. So the reason that some people have intrusive thoughts worse than others is because everybody has intrusive thoughts, okay? You're not weird for having those. Everybody has them, but the average person has the ability to stop thinking about that intrusive thought. Some people have less ability than others. So, along with ridding you of those intrusive thoughts that you want to get rid of, we insert a device that helps your brain function as it's intended to. It helps you personally rid yourself of those thoughts. So they're still there, they could still come back, but it gives you more control over it for yourself. I mean, we love having business, we love, doing the surgery for people, but in an ideal world, we want to fix the problem completely, not just a temporary solution. Let me check that. So we've improved the surgery so that we have been giving our patients the ability to control their thoughts better. And the success rate of that has been so good. Originally, after about 2 years, people were needing to come back for a second surgery, sometimes for different intrusive thoughts altogether. But since we've started inserting the tiny little implant when we do the surgery, the need to come back has been reduced by about 75%. People are starting to have more control over their own thoughts, which is ideally what we wanted to always do. Okay, I'm going to go in and clean this one out. Absolutely. That's the goal. That's what we want you to be able to do. You know, it is a business and we do make money, but our founder, you know, struggles with their own intrusive thoughts. And the idea of this clinic was always to help people more than anything. So if we can permanently fix a problem, that's what we want. That's what we're looking for. This one's a little messier. It's going to take me a second here. Yeah, pretty much everyone at the clinic has had it done. Although most of us don't suffer from like the uncontrollable kind. Once we had, you know, perfected the surgery, it was something we were all encouraged to do, was to get it done so that we could have our own experience to relate to people. It's a little tougher for us. Our reoccurrence is higher because we work in a clinic where we learn what other people's intrusive thoughts are. And so sometimes our intrusive thoughts are related to other people's, and part of the treatment for this originally, before we had where'd my otoscope out? Oh, there it is. Before we had the implant, part of the treatment was to avoid things that would remind you of your intrusive thought, because it could come back. You know, the brain heals itself. You can take things out and we can remake those neurons, can reconnect them. So, you know, part of the treatment plan was to try to forget that intrusive thought existed, which is why we've been focusing pretty heavily on the implant. Yeah, so I've had the surgery, but those intrusive thoughts do come back because I get to witness a lot of people's intrusive thoughts. But I don't struggle as badly as some people do. I'm fortunate in that. If I did, I'd be 100% behind getting the implant myself. Okay, I think I got it all. Okay, perfect. Alright, we're ready for the sensors, but that's not what we're actually doing next. I need to do some measuring, partially because we have two different sets of sensors that we're going to use, or that we do use. So, I know this looks kind of medieval. It's just calipers. I'm going to be measuring your head circumference in a couple places. We're also needing to measure your ears, inside of your ears as well, so that we know what tools to be using during the surgery. So, I'm just going to open this up so that it'll fit your head. Not that you have a giant head or anything. Okay. I guess it's not the circumference, it's the diameter. I apologize. Okay. Okay, it's 20. Okay, 22 and a half on that side. Okay. I'm just going to measure the inside of your ears, okay? And it's gonna feel cold. This is a pretty cold little thing. So we just need to get an idea of what tools we can use. Okay. Yeah, we do have to do both sides. That was 5 millimeters. Get okay, now it's a little bigger. Bigger is better, obviously. Not that we can't work with small, but it helps us use more precise tools. Okay. Now I'm just going to do some basic tape measuring, okay? 6.5. 4.25. I'm doing centimeters, yeah. I think we need to use size B for our electrodes. The precision with which they're placed is exceedingly important. It takes me a while to place them, honestly, because they can only scan so many parts. We have sort of an idea of where they need to be placed based on the answers that you gave us on the survey, but this is going to help me get them exactly where they need to go. We need to put some like on the inside of your ears. We have some tiny electrodes that we stick up in there, and then there'll be a couple on your head. Okay, that was 4.25. We will have to put a couple in your hair, but don't worry. They come off pretty easily. We don't have to shave or anything. So we'll be able to fit one. Okay. All right. Well, you don't have to be nervous. I understand why you're nervous, but don't worry. There's no way for you to be damaged. There is a possibility it won't work, but when it doesn't work, we allow you to come back in for free. We guarantee at least a year of, as long as you don't expose yourself to the intrusive thought again. That one we can't control, and then we have to recharge you. So, but hopefully with the new device inserted, that won't be a problem because you'll just gain better control over getting rid of those intrusive thoughts. That's what we're aiming for. It's 9. Right there. So, okay. I think I am good, and I know where to put the sensors now. I am, if it's okay with you, my hands are washed under here. I'm going to take off my gloves for this part because the electrodes tend to stick to my hands, and the gloves make it impossible. So, I'm going to start with the electrodes on the inside of your ear. Okay? These are very tiny. And it's going to take me a second here. I'm going to need my tweezers for this. Okay. So it needs to be placed exactly at the back of the ear canal, right here. And because we cleaned it, it shouldn't have any trouble sticking. Okay. And it takes me a minute because I have to be so freaking precise with it. Okay, I'm sorry, I have to take it off and start again. Yeah, I need a new one. If it sticks too many times to your skin, then you have too many like bits of skin on it, so I gotta do a different one. Okay, we're gonna go back in. So it's supposed to be right on there. There we go. Oh, I got it perfectly. That is beautiful. Okay. Try not to move too much. Let's do the other one. The other ones are easier than this, the ones on your face and hair. But okay, going to the back right here. And I think that it needs to be slightly up for this side. One of the thoughts that we're removing is primarily over here on your right side. And this one should be able to tell us exactly where it is. Okay. There we go. There we go. Perfect. Okay. Again, try not to move. Okay. Now I'm just gonna do them on your face and stuff. Okay. gonna put one right here. It takes me a minute to get it in the right spot. Okay, come on. I think I need to like tilt it by 45 degrees. Let's do like, there we go. So the next one's gonna go behind your head just a little bit, like right up here. It will be in your hair, but it will come out easily, okay? So it's just going right behind your head, right here. And I think I need it at a 172 degree angle. Like, just like, let me consult my guide really quick. 77, sorry. This one's slightly. There we go. Let's get it right back here. See, it didn't pull on your hair at all, huh? Yeah, we made some special ones that work without people having to shave, you know. The advantage of us doing the surgery through the ear, and like there's no evidence you've had the surgery done physically, which is really nice. Okay, other side. Oh, let me check. Okay, we're still using the B size. Grab these. Oh god, it takes me like twice as long with gloves on. Okay, this is the one that goes in front of your ear. Put it right. No, it needs to be tilted just a little bit more. Nope. Again. There. There we go. Perfect. Grab the other one. So this one is going to go in a slightly different place. It will go still on the back of your head, but it's going to be up in your hairline quite a bit more, okay? We're pinpointing about 1/100th of thought, trying not to talk about it. That's right up, like, right here in your head, okay? So we've got two more after this. So this one's going up on your head right here. We're gonna put it like right. Yeah, we'll attach they don't have any cord wire attached to them yet, because that makes it too hard for them to put on. Okay, I got that one right the first time. Lucky. Okay, we're gonna put two on this part of your head, okay? And then we'll hook you up. Yeah, so we ask you to think about it. We pinpoint and then I will do just a little fancy keyboard work. We'll send you a small shock through. Gives you a temporary, like, erasing of that memory. So if it comes back later, just through things that happen. But this should give you some relief from it till your surgery date. So, yeah. So it's not unpleasant for long. Okay, there we go. Oh, that's what we were originally using before we developed the actual surgery. We were just doing the small electrical shock to that part of the brain. It was working, but it was very temporary. Like, it only worked for a couple days. Yeah, we wanted permanent solutions, so. Okay. There we go. Okay. Last one. Yeah, so it'll be just for a moment and then it'll be gone. And then we'll get you in for the surgery. Well, like I said, we can only guarantee for up to a year still. The implant is, it's not quite there yet. Like, it's not to the point that we can guarantee it. Oh, that was perfect. Perfect. Okay. So, I am going to start with the one inside of your ear. We'll just see if we can. Let me grab my. Yeah. Perfect. Okay. Then we're going to attach this one. Okay. The one on. There we go. That one's the one on your bottom of your nape. And this one's at the top of your head. There we go. Okay, then the little one on the inside. There we go. Oh, that was fast. Okay, that's the one in front of your ear. Then we're getting the one on the back. Okay. And your last one right there. Perfect. Perfect. Okay. I'm getting you hooked up now to our computer. We're running the program we wrote just for you and your thoughts. Okay? Alright. It's currently on. We have 3 thoughts that we're getting rid of. I would like you to think of the one that you listed first. Okay? I'll watch the machine. Okay. Okay. Alright, I'd like you to think of the second that was on your list so we can pinpoint it. Okay? Looks like it's in quadrant 3. I need you to think just a little bit harder about it. Perfect. Alright, I've got it pinpointed. And I'm marking it. Alright, third one. And then we'll send the shocks, okay? They're very gentle shocks. Okay. Now think of it exactly as you want to get rid of it. watching that section of your brain light up. Just a little more. Perfect. All right. We have all of those marked. I'm going to send a very small electrical shock to each location, okay? There'll be no pain at all, and it'll help you forget about them till the surgery. Ready? How are you feeling? Good. All right. I'm going to go ahead and get these off of you now. Oh. Okay. We're going to take these off now and get them put away. I'm going to pull this one out of your ear first. Other side too. How are you feeling? Yeah, it gives a little bit of a euphoria. Okay, let's get that. Yeah, it can make you feel a little euphoric, and it might make you feel just a little bit dazed. We do suggest that you don't do anything particularly dangerous the day of, okay? Yeah. No, there's nothing to be worried about. We have our best surgeon working on your case. Well, I'm going to be honest, she's our only surgeon. She's also our best. You have nothing to worry about. Okay, got all the electrodes off. You're good to go. You have somebody driving you, right? Good, good. We do offer a taxi service home if not. Okay, you have a really wonderful rest of your week and we'll see you for the surgery, okay?